Thank you, Professor Azzolini. Thanks for inviting me here to this session. And yes, 20 years ago we started experimenting on telemedicine, and really at that point the barrier was the technology. Technology 20 years ago was cost and speed of communication. Now this is not anymore a problem in most of the mature countries, and I think we have over the world 5.3 billion people connected to internet. So there are still 4 billion to go, and I think United Nations has an objective by 2030 to get everyone in the world to be connected to internet, and this is one of the main points. Can we go to the next slide? So technology nowadays is a commodity. Is a commodity. What it means is a question to, and Professor Azzolini mentioned it, is a question of organization. You need to organize not only the project and how you want to sustain it, but also the technology part. So commoditization of the technology, it means many actors, many vendors that are competing and providing you different kind of technologies that you can adopt in a modular mode to the project that you want to implement with the telemedicine. If we go to the next slide, we can have some example of which are the major technology that we can interoperate today to execute telemedicine. But as you can see, interconnectivity is above all of those. It doesn't matter where, which geography, and the maturity of the country. It matters if you have connectivity or not, and then you can access any kind of advanced or standard technology. Cloud storage and computing gives us full scalability and infinite resources. Video conferencing software, especially during the pandemic, and now the capabilities that those software can be embedded in platforms and so on is incredible, with real-time translation that will facilitate also interaction, doctors with patients, doctors with doctors in different languages. This is a secure messaging platform, mobile health application connected with any kind of wearable technologies. You know, now everyone have a intelligent watch. Now rings are coming that can measure heart rate. They can measure even blood glycemic values and so on. And this can be integrated in those platforms easily. So the point is how the approach should be really a modular approach, a component-based approach, where the platforms should be agnostic on what is the technology and should use the technology because there is a need or a capability that need to be satisfied for the relationship of patient and doctor and doctor, because it's also about I think it's really these two angles of where telemedicine can really have an impact. On top of that, AI and generative AI now really plays a role. If we go to the next slide, we can also see. Generative AI generate content, right? Generate new things out of specific algorithms that the machine, the artificial intelligence can be programmed for, especially using large language models, where we can again in a modular mode embed those components and have the telemedicine platform to have automatic suggestion and personalize the content of for each patient, automatize some administrative part, because one of the questions also is how we have the physician to be focused on the patient without spending time on bureaucracy. Sometimes technology is introducing burden of bureaucracy. So this is where Professor Azzolini mentioned that we need to have the technology expert and the physician working together very well. Otherwise, this is not going to work. Technology can bring in complexity instead of facilitating. Enhanced patient engagement, clinical documentation. These are all things that generative AI can bring in. Diagnostic support also, of course, especially when we are discussing about images. So there is a lot of advanced algorithm to identify hidden paths on image and help to perform diagnosis. This is something where generative AI can really help. So at the end, it augments the capacity to deliver personalized care and ensuring the HCP to be really dedicated time and focus where their expertise is more needed on the patient. Okay, if we go to the next slide, I think here is about my personal thinking in terms of approach. The technologies, yes, are powerful enablers, right? But what is important is to establish a framework that guarantees a robust standard, protocols, and especially cost control, because all those technologies are at the fingerprint of a viability. You can choose the component, put it on in, but we need to. It's very easy from a proof of concept to a project when you move at scale, a large scale, where the cost explode out of control. So a cost control framework must be established using those technologies. And what I would say is an experimental approach in any case, because new technologies, new capability will continue to come. So it will be very, very important to keep the experimental continuous improvement approach where the platforms can be agile and add new capabilities over time. Last but not least, I think we have the last slide. Now this is a sentence from a Spanish poet, but the concept is that there is no real path. The path is made by walking, and I think this is what telemedicine needs to do for the future. Thank you.